Good evening, Barbadians and residents of Barbados. I'm very happy to be here this evening, not to deliver any sort of a press briefing per se, but to have a conversation, to have a chat with you as we get ready to go into the period of the 2 bank holidays. But first of all, let me wish each and every one of you a very happy Emancipation Day. This is a very significant day in the national calendar, and I believe that we all should observe this day and celebrate this day and remember those who've gone before us, who would have laid the foundation for that which we now enjoy. I start by informing you of the test results for today. We would have conducted 1,705 tests at the Best Dos Santos Public Health Laboratory, and those tests would have yielded 17 positive cases, 17 positive cases. But I would like to put this within some context to be able to explain to you why I am having this conversation with you today. I know you could be doing other things, and so do I, but I consider it important given what I'm going to say. Over the last 3 days, we would have done about 4,378 tests, and we would have had about 42 positive cases, averaging about 14 cases per day. And it is not so much about the figures because the positivity rate is still below 1%. And even though the cumulative incidence per 100,000 of the population is climbing and has gone beyond the threshold that we've established, we are still not in any situation where our capacity is overwhelmed. But I thought I would speak to these figures in the sense that on Thursday, we had one single case. And this case yielded another 10 positives the following day as a result of the contact tracing. And once we had those figures and the information related to the positive cases, it was quite clear to the staff at the Ministry of Health and Wellness that this was a potential problem. And why I say that is because these cases involve and include persons who would have done some bar hopping at some bars within the city of Bridgetown and in the general St. Michael area. And because of the nature of those visits at those bars, we knew that we had to move very, very fast to be able to contain a spread in this particular cluster, which is now a new cluster. So we would have expended a lot of resources to be able to do the contact tracing and the containing, and also quarantining primary contacts and so on. And those efforts are ongoing. And I would like to thank the management of those establishments for cooperating with the team in terms of trying to identify primary contacts and to make all of the information they have available to us so that we can do the job that is required. But I want to speak today because what this represents, and we've seen this before in some of the clusters that we're still dealing with. And it really is a question of each and every one of us taking the time to exercise good judgment, make good choices, and to be the type of corporate citizens that we want each and every one of us to be. And I know that in recent times, the conversation has been centered around vaccines, and then we have the anti-vaxxers and so on, and that already has been taking up a lot of the space in social media and conventional media. And whilst that discussion is important, and I would always encourage persons to be fully vaccinated, what I have constantly indicated during press conferences, and I remember from as early as over a year ago, when we didn't have a lot of vaccines, I would have said to this country that there are levels of defense that we have established to be able to keep Barbados and Barbadians safe. And those levels of defenses really include the entry protocols, the quarantining, and the various other things that we do. And the final level would have been the vaccines or becoming vaccinated. But the truth is, and I keep saying this all the time, at the end of the day, whether or not we have persons coming in, whether or not we have persons fully vaccinated, the protocols, the public health measures remain very, very, very important. That is the masking, sanitizing hands, respiratory etiquette, social distancing, and so on. And this is where we continue, and I don't know if it's because people sense that perhaps COVID is not on island, because we've had periods of time when the numbers have been very low. And indeed, prior to this recent cluster, we've actually had about 2 or 3 days where the number of positives have been in single digits. And the number of tests have all exceeded the 1,000 mark. So this may be a reason why there's a sense of complacency, and perhaps also because people feel that since they're fully vaccinated, that they don't longer have to do these things. And this is why I am here to speak today, because this is absolutely not true. Our ability to fight this virus, our ability to try to maintain the standard of living that we are accustomed to with the existence of this virus, depends on each and every one of us doing these things on a daily basis. And I'm here to ask all persons to please understand that this is the most important thing that we can do at this point in time. And if we do not do these things, if we do not continue to practice these things, then we are going to find ourselves in trouble. And I say that recognizing that with the best will in the world, there's no way that we're going to get everyone to do everything that is required. And there are times when people drop the guard, even within their own households, because that's a natural thing and you feel comfortable. I'm not going to ask you to do that which you might consider to be impossible, but I'm going to ask you to reduce the level of risk, reduce the level of exposure, and help us to reduce the spread of coronavirus in this country. So that when you are going, and I'll give you some simple tips that I believe would be able to help you. I'm not going to tell you don't go to a bar or to a restaurant, because that is part of life, part of living. And as long as we allow those activities to take place, then you are free to participate in those activities. But what I can ask you to do is to limit your exposure. And when I say limit your exposure, limit the number of establishments that you may want to visit. Limit your exposure within these establishments. I know it is easy to go into a bar and sit at a bar, have a drink, and then you start a conversation, whether it's about the Olympics or the West Indies series against Pakistan. These are natural things that happen within the environment of a bar, especially a sports bar. These discussions happen within churches and all other establishments, and things can happen. But I'm saying to you, limit your exposure, especially if you are in establishments and you do not know the persons who are around you. And especially if you are in a situation where you don't have a lot of space, you need to be very, very, very careful and very, very cautious. And what do I mean by that? In order to have a drink at a bar, you have to remove the mask. That's a given. If you are not in an area where you're with your bubble, your household, or people that you are there with and comfortable with and that you share space with, then the best thing to do is to limit the exposure by removing the mask when you are going to have a sip and then replacing the mask. And if you're going to be speaking in that sort of environment, keep the mask on while you are speaking. If you're going to be visiting a bathroom for any reason, keep the mask on when you are moving around within the space. And this goes for restaurants, for bars, and for similar institutions. And this is really, really important to help us to be able to sustain the fight against COVID and to win the fight against COVID. None of us want to go back to January, February, and March. I don't know about you, but for me, it was a nightmare, and the staff in the Ministry of Health and Wellness. In fact, we still live some of the nightmares because of some of the things that we still see happening. And we do not, because we know that this country cannot afford another lockdown. And lockdown is not something that we like to impose on persons. We only go there if we think it is absolutely necessary. And let me state up front that at this point in time, we're not contemplating a lockdown, so don't get me wrong at all. But hear this. If the situations that have been confronting us over the last several weeks go unabated, then that could put us in a position where we may have to look at other options of restrictions. And we don't want to go there, definitely not. But it has to do with our capacity to manage incidence of positive cases in the country and to be able to do what is required to contain a spread. And I'm not saying that we are under any significant threat or we're about to be overwhelmed. We are working hard and we believe that we can do what is required. But this is the problem. As soon as we finish with one, something else comes up along the same lines because of the same errors, because of the same mistakes. And then we are back to square one. And we really need to be able to do something about this. But you know, we can't do it by ourselves. We need you. We need the cooperation and collaboration of all persons on this island. And to remember at all times, you need to limit your exposure. And not only that, but remember that when you fail to limit your exposure, you are increasing the exposure of your loved ones and your family, your friends, and those who you are in close contact with. And that is what causes a spread when you do not limit your exposure. So I'm pleading with you, help us. Don't let us allow things to get out of hand. We cannot, the country cannot afford to go back to January and February. We cannot afford a lockdown, not even the Ministry of Health and Wellness, because when we have lockdowns and we have those bad times, we are unable to provide some very important healthcare services to other members of this community, including and especially involving persons who suffer with non-communicable diseases, chronic non-communicable diseases. And this is something that is a sad story, and we don't want to go there. So I'm asking you over the next 2 days, there are 2 public holidays, and we know that culturally, we tend to let our hair down during public holidays. But I want you to remember and focus on our ancestors, our forefathers, and remembering today's Emancipation Day. And although persons became emancipated, it did not mean that everything was thrown through the window. We have to manage the risk that we take. We do so as a country, and we are asking you as citizens and residents of this country and visitors to this country to help us to manage the risk and the exposure so that we do not find ourselves in difficulty. And so I'm really hoping that over the next few days that we would not see any significant increase in this particular cluster. The other clusters that we've been dealing with, generally speaking, we've not seen any movement that would worry us, but this one has the potential. It has the potential, and not because it is in a particular sector of the society, But because the number of persons who frequent institutions of this nature come from all over the country, and that is a recipe for the spread of coronavirus. That is what is going to cause problems. And so we really would like for those, the management of those institutions to continue to work with us. And you know your clientele. If you can get in touch with those persons and ask those persons who we may not have been able to contact at this point in time to make themselves available for testing so that we can bring this thing to as quick an end as we possibly can. So that is what I wanted to speak to you about, because this is about the third time that we've been seeing something like this. This month of July really has been a tough one in terms of cases and having to deal with multiple clusters. And if we are going to have a better August and September and going forward, then we need to be able to show some restraint. Nothing that is being enforced. We're not going to touch anything in relation to the current easing of restrictions. We're not going to put anything back there because we know the results of those as well. And we want people to be able to enjoy themselves within a COVID environment, but to do it safely. And to remember at all times that the protocols are there for a reason. Do not overexpose yourselves. Thank you and enjoy the remainder of this Emancipation Day.